key thing is for health system pharmacists to get involved. I guess one of the easiest things to start off with would be simply protocol development. I mean, patients that present to institutions that have a streamlined protocol for managing patients with acute coronary syndromes overwhelmingly do better. And sometimes these are developed without the assistance of a pharmacist. So I think first and foremost, being involved in the teams that actually develop this would be great. But also, every transition point in the care of the patient would be important. So in terms of initial admission, medication reconciliation would be extremely important because we would be looking to see if they're on an anticoagulant or anything else, and that would determine how long we could do antiplatelet therapy. We'd also want to make sure that they're getting proper dosages of their medications and so forth. Then we would want to see them before they go into the cath lab to make sure they're loaded appropriately and they have the correct regimen of agents. And then post-cath lab care would also be another great time. You know, one of the cardiologists that I work with, we had talked about developing a project where we basically take our pharmacy students and put them in a room with a lot of our post-cath patients, simply for educational focus rounds, to explain to them the importance of maintaining antiplatelet therapy, especially for the first 30 days, where if their adherence to the regimen is poor, it could lead to an extremely detrimental outcome. So transitions of care are key, and then discharge counseling, obviously. First fills in a hospital would be great, because that way we don't have to worry about a patient actually leaving the institution and potentially not purchasing one of these medications. We can make sure they can afford them. And then, of course, follow-up. So whether it be a handoff to the community pharmacist or a phone call within the first 3 to 7 days post-discharge to ensure that the patient is not having any trouble with their medications, we don't need to make the switches would be key.